take medications at specific times. Have you ever wondered why your doctor or your pharmacist gives you very specific instructions on when and how to take your medications? Morning, evening, with food, before bed, after waking up 30 minutes before having breakfast? I can understand it can get oddly specific and honestly annoying at times, right? But let's dive into the science behind why medications must be scheduled so strictly. Pharmacology, if I'm being honest, wasn't my favorite subject in medical school, but it is important to go over some basic principles of pharmacology to really understand why medications are dosed the way they are. First is half-life, which is defined as the time required for the concentration of a specific drug to decrease to half of its initial amount in the body. So how this works is when you take a medication orally, the drug is slowly absorbed into your blood and its concentration increases until it reaches a peak, and then it slowly decreases as the drug gets metabolized. So let's take ibuprofen for example, which has a half-life of around 2 hours. So let's say you take a 400 milligram tablet at hour 0, that gets 100% absorbed into your blood. In reality, not all 100% is going to be absorbed when it's taken orally, but for the simplicity of today's discussion, we're going to make two assumptions. First is that all 100% of the orally taken drug is absorbed into your bloodstream, and second, quantity equals concentration, just to keep the numbers a little clear. So, you took a 400 milligram tablet at hour 0, it'll reach its peak concentration in your bloodstream at 2 hours, so that'll be 400. At 4 hours, only half of that concentration will remain in the bloodstream, so that'll be 200. By hour 6, it'll be 100, and by hour 8, it'll be 50, and so on. The next concept is therapeutic window, which is the range of doses at which a medication is effective without unacceptable adverse events. So, depending on the half-life of the medication, it is dosed at regular intervals, such that a steady concentration of the drug within the therapeutic range is maintained in your body. This is the reason why if you are told to take a drug twice daily, you cannot just take 2 pills at the same time and be done with it. You double up, you risk overshooting and going into the danger zone. And if you do miss a dose, you might risk dropping below that effective level and not getting the needed effects of that medication.